Welcome back to the Lowcountry Report. On February 1st this year, Medicaid in South Carolina will no longer cover the cost of hospice care for terminally ill patients. People who are already enrolled with hospice as of February 1st will have their coverage continued for up to 90 days by Medicaid. Here to talk about the impact of this decision, we have with us Susan Saxon, Administrator for Tidewater Hospice. Hi, Susan. Thanks for coming in.
Hi, Allie. Thanks for having me.
Well, what about it? How will this impact hospice patients or people getting ready to enter hospice care around the state and specifically with people you work with?
Well, fortunately for Tidewater Hospice, we've been able to assure all of our Medicaid patients who are looking to lose their benefit that we'll continue to be able to provide their hospice care without any gaps in coverage. We have a foundation to which the community generously gives, and this helps us bridge the gap in care for our patients who can't afford care. Having said that, we're very concerned what's going to happen around the rest of the state because all hospices may not be in a position to be able to provide care gratis. We think that these folks are going to end up in emergency rooms, which are already overburdened, hospitals, nursing homes, and we feel that these are places that are not well equipped to handle people who need hospice end-of-life care.
Well, let me ask you this. You say not well equipped. When we look at costs themselves, isn't it true that care that hospice patients instead would receive in an emergency room, nursing home setting and the like, isn't that more costly?
It certainly is. Hospice care is a cost-saving benefit. The government recognized that back in the mid-'80s and made it a covered benefit for Medicare, for Medicaid, and for most private insurance companies. We feel that the cost to the Medicaid program, as they start seeing this increase in visits to the beneficiaries, to emergency rooms, to hospitals, is really going to end up costing the Medicaid more money, and we feel that those savings are absolutely illusory.
Well, you mentioned that they're going to discover, your prediction that they'll discover it's more costly. Isn't that actually the case of what happened in the state of Arizona?
That is absolutely what happened. Arizona tried this cut in the hospice benefit for a year, and in that year they found that their overall Medicaid cost actually increased by 4%.
I want to get your reaction, if I could, to something released by a spokesperson with Health and Human Services in the state of South Carolina. This was actually in the Island Packet. And, quote, "We recognize," and this is in regards to cutting hospice care benefits through Medicaid. The quote is this: "We recognize the danger of driving up long-term costs, but we don't have the luxury of being able to think long-term in that regard. We have to make cuts that chip away at this year's deficit." What's your reaction to that?
Again, we don't feel that this is a sound business decision. The Medicaid budget line items, hospitalization, emergent care, nursing home costs are enormous, and we feel that the loss of savings from the Medicaid program is going to cost Medicaid immeasurable dollars. We are also looking at losing federal subsidies for our Medicaid program to the tune of, I think, $29 million in not having these programs, which we're having cut now.
Wow.
So it just doesn't really make sound business sense to us.
For the person that may be wondering, Susan, specifically what hospice care is, can you speak to what it is that you provide?
Tidewater Hospice provides end-of-life symptom management and comfort care to patients and their families, usually in a patient's own home.
You had told me before we began taping that some of the patients that you work with had actually gotten notification of those Medicaid benefits ending as of February 1st. That has got to be really disheartening and upsetting for somebody that's, facing the end of life to get that kind of news.
Well, the travesty is that end of life brings about a lot of uncertainty, a lot of fear, and as hospice, those are the things that we help patients and their families work on. We try to explain to them what's going to happen. We try to assuage their fears so that when someone receives a letter in the mail that says all of a sudden your health care benefit for hospice is going away, then those fears and those uncertainties escalate. We again felt very good to be able to assure our patients that they would not be losing their hospice benefit, that we would continue to provide that. But again, it is very disheartening to think that there are folks all across the state who are in that position and are having those feelings and reactions to the loss of their benefit.
Before we let you go, Susan Saxon, any final message that you want to get out to people in our area regarding hospice care and the loss of coverage through Medicaid come February 1st?
I would encourage other providers to continue to spread the word about the cuts. I would encourage the public to become informed and notify at your local level your legislators and ask them to reconsider and to repeal this devastating cut to Medicaid.
Well, Susan Saxon of Tidewater Hospice, I want to thank you so much for joining me on the Lowcountry Report.
Thank you.
And we will be back with more for you in just a moment. Stay right there.